So today we will discuss about that how to describe a medical condition in a layman term. Regarding preparation of faces, so it comes in the skill of communication that at the end of we do the closure, especially in station 2 and 5, and in the beginning of the station 4, that we have to explain the disease condition to the patient. So if we use jargon, means if we use the medical term, so it goes in our negative, and examiner they can deduct your marks. So it's better while explaining to the patient and talking to the patient, it's always advisable to avoid the medical terminologies. So we will discuss that how to explain different conditions, health problems in simple layman term, and how to do the closure at the end of the history station. So suppose if a patient who is presented to you in the history station or in station 5. So in history station, we do closure in some detail, but in station 5, because we are very short of time, so we will just explain grossly. For example, the patient is presented to you with the loose stools and tummy pain, and the diagnosis or the probable diagnosis is some inflammatory bowel disease. So in the layman term, we can tell the patient that from the history, it looked like that you are having a condition which is called the inflammatory bowel disease. So don't be bothered by the name. So it's a condition in which there is some swelling or soreness. Some examiners they take soreness as jargon, and some says that it is not a jargon. So we can say either it's soreness or swelling. So we can say that there is some swelling in the lining of your bowel that is causing your symptoms, right? So in history, we will tell in detail that your symptoms of these loose stool and tummy pain and the weight loss you are having, or if the patient is having any intestinal manifestation like any joint problem or eye problem, so we can relate to that. So in his station 5, just we will tell that it is some swelling in the lining of your bowel that is causing your symptoms, right? So in this way, we'll explain to the patient, and we will briefly tell that for the confirmation of the diagnosis, we will do some tests, some of the blood test and some test new tools, and we need to do a camera test for the confirmation of the diagnosis. And we will also take some snip from the lining of your bowel. Okay. So in this way, we will tell the patient that what the patient is having in a term, in a non-medical term, you can say. So this was simply about the IBD. So next, this is just a disease explanation. Okay. Further, we can add that for your treatment, we will start with some medication. So if it comes in station 4, so we will further tell that if I'm going to make a team of different specialists that will involve the bowel doctor and the dietitian who will guide you for your what type of food to take and what type of food to avoid. And if the patient is having any problem managing a job or at the workplace, so for the workplace, we will involve the occupational health physician, and for assistant at home, we can involve the social services and social workers. So in this way, we'll do the closure. Okay. So for the further diseases, I'm going to make separate audios for all the diseases. So it will be helpful that any particular condition you want to click, you can listen from there. Okay. So thank you.